Even before Obamacare was implemented, President Obama's repeated promise that if you like your doctor and health plan, you could keep them, was labeled PolitiFact's 2013 Lie of the Year. In a recent column, the Washington Post stated, quote, "The real problem is that the Affordable Care Act was never actually affordable." Today's witnesses will provide the gory details of exactly how unaffordable and damaging the signature legislation of President Obama and the Democrat Party has been. I've asked our three majority witnesses to each address a specific area where the damage has occurred. Our first witness, Joel White, will describe how further expansion of the third-party payer system under Obamacare has led to greater consolidation within all sectors of the healthcare industry, dramatically reducing competition and driving up costs. Our second witness, Taryn Bragdon, will describe the damage done to Medicaid and those who Medicaid was originally designed to help. Our third witness, Brian Blaze, will detail how the insurance market for individuals was dismantled and replaced by the Rube Goldberg Obamacare marketplace exchanges that, contrary to President Obama's promise of lowering family premiums by $2,500 a year, have caused premiums and deductibles to skyrocket. The witness for the minority, Shannon Verstegen, is a fellow Wisconsinite who I have a great deal of sympathy for. She is a victim of Obamacare's skyrocketing premiums and the limitations on small employers joining association plans, thereby forcing their employees onto the unaffordable exchanges. In Wisconsin, Obamacare exchange plans have increased 3.3 times the rate of inflation since 2013, whereas employer-sponsored insurance has risen at 1.6 times the rate. As a result, Ms. Verstegen's premium is more than $5,000 higher because of Obamacare. And if you compare it against inflation rate, that's about $7,500 higher than it probably should have been had we actually controlled costs with a health care plan. Today's hearing will highlight Obamacare's failure to meet its objectives. In March 2010, CBO score used to pass Obamacare, it projected it would reduce deficits by $143 billion over 10 years and reduce the number of uninsured by 32 million by 2019. In 2013, the year before Obamacare implementation, 55 million Americans were enrolled in Medicaid. By 2019, that figure had increased by 17 million to 72 million, with Medicaid expansion accounting for 19 million of that total. That means enrollment in traditional Medicaid actually decreased by 2 million individuals over that time period. I know it's a lot of numbers. There's more to come. There were 12 million people enrolled in the individual market in 2013 and 14 million enrolled in Obamacare marketplace exchanges in 2019 for a net gain of 2 million. So you add that 2 million to the 17 million added to Medicaid, and the net reduction of uninsured due to the implementation of Obamacare was 19 million by 2019, only 59% of the 32 million originally projected by CBO. So first lesson there is kind of ignore CBO scores. They're not that accurate. Comparing 2025 to 2013, there are now 22 million more people enrolled in Medicaid and 12 million more enrolled on the individual exchanges, indicating a 34 million increase in enrollment. But wait, what is unknown, however, is how many illegal immigrants are included in the enrollment figures and how many phantom policies have been written for people who don't know they were enrolled and as a result make no claims. One estimate for 2023 puts the number of non-citizens enrolled in Medicaid alone at roughly 4.6 million. Addressing phantom policies on the exchanges, Brian Blaze will testify that in, quote, in 2025, improper enrollment in fully subsidized plans reached 6.4 million people, with associated improper federal spending exceeding $27 billion. So that's 11 million of the 34 million that should not be enrolled or maybe don't even exist. Obamacare is spread over multiple programs and agencies that have failed to adequately segregate its differentiated costs. So it's impossible to compare its actual impact on federal deficits versus CBO's March 2010 score. But I doubt many would argue that Obamacare actually reduced the deficit. We can, however, look at various spending components to get some sense of how it failed fiscally. Now, these two charts, and I'll just describe them. What we have is state-by-state comparison to 2013 premiums versus 2026. And you're seeing the percent increase. The red line shows the 39% increase in the CPI. So inflation went up 39%, but you can see on the individual exchanges, the average number of all those state increases was 169%, 4.3 times the rate of inflation. Compare that to employer-sponsored plans, which weren't affected as much by Obamacare, but there's also no reason that they should have increased at 1.9 times the rate of inflation. I mean, there's no reason for healthcare costs to be running this much higher than inflation, but again, you can see the exchanges are far worse than the inflation or the premium increases in the employer-sponsored plans. You can take those down. Federal spending on Medicaid has skyrocketed from $265 billion in fiscal year 2013 to $669 billion projected for fiscal year 2025. The cost of subsidies on the individual exchanges is projected to be $129 billion for fiscal year 2025, with the cost of the temporary pandemic-enhanced subsidies accounting for $20 billion of that total. The federal government takeover of the student loan program was supposed to help pay for Obamacare by reducing the deficit by $19 billion. Instead, there's been an additional $620 billion spent on debt cancellations and Biden administration's income-driven repayments. So instead of saving $19 billion, we spent $620 billion taking over student loans. Now, unfortunately, instead of acknowledging all the damage done by the faulty design of Obamacare and working in good faith with Republicans to repair it, Democrats simply want to spend hundreds of billions of dollars more in their attempt to continue to hide its failure. Extending the enhanced subsidies, the temporary subsidies Democrats designed to expire this year, not Republicans, Democrats set these to expire this year, would cost $350 billion over 10 years, plus an additional $60 billion in debt servicing costs. Lowering the health care costs and providing more American citizens with affordable insurance and covering individuals with pre-existing conditions are goals we all share. Unfortunately, Obamacare failed miserably at lowering costs and meeting enrollment goals. Accomplishing those goals could have been done by understanding and relying upon the benefits of consumerism and free market competition. By relying on those principles and returning to free choice for Americans, we can repair the damage done by Obamacare and transition to a health care system that actually works.